Let's find out how the magnetic mallet works. A device conceived, engineered, and manufactured in Italy and sold throughout the world. It will innovate the entire experience of the users. The magnetic mallet is based on the discovery of a new principle. It is a wave that we will call power wave. This pulse is patented, safe, and very effective. Its functioning has been tested and approved by various universities and key opinion leaders around the world. Let's see the graphic showing the effect of the power wave from a physical point of view. Clearly notice the difference between the purple line, the manual mallet, and the blue line, the power wave at force 4. Look at this diagram. This is all about it. How many times the doctor has to use the manual mallet with the osteotomes to perform Dr. Summers' technique, extractions, ridge splitting? Would you like to be the patient? Well, the manual mallet is no longer needed. With a much more gentle approach, but in the meantime more powerful, it is now possible to perform the same procedures without causing any trauma for the patient. Incredible, isn't it? This video is about a validation test performed by the engineering department of the University of Illinois. It explains the way the power wave works. There is more power delivered and less dispersion of the force of the craniofacial mass. Power wave is the power of a high-speed wave. There is more compliance for the patient, no movement of the head, and even more important, no dislodging of the otoliths, which is what usually cause post-op vertigos. The advantages of magnetic mallet compared to the manual hammer in the osteotome practice. We used a simulator representing the craniofacial mask with its jaw and some spheres simulating the inner ear otoliths. The bottom structure springs react like the neck of the patient. The hammer is handled by the right hand, and consequently, the osteotome must be held by the left one, provoking a certain difficulty positioning the osteotome in the site. Giving the hit with a hammer, the craniofacial mask is totally affected by the impact, and the spheres are heavily diverted. Using the magnetic mallet, the spheres remain in place as the craniofacial mass is not affected by the impact. Therefore, the advantages for your customers lay in the secret of the power wave pulse. Let's see which are the application fields our doctors can use the magnetic mallet for. As you can see, there are multiple procedures. making the magnetic mallet a device for the everyday practice. Let's see all of them and the advantages for the doctor and the patient when performing procedures with the magnetic mallet. The most common daily use is certainly the extraction. Instead of using forceps, which frequently leads to break the tooth, the extraction tip of the magnetic mallet stimulates the root detachment. It is very intuitive, the easiness of the way this is done. It is safe and always preserves the lamina dura. You can notice this by looking at the untouched contour of the socket. There's a lot of talk about conservative extraction. Magnetic mallet is the way to do it. If the extraction is well performed, thanks to the magnetic mallet, preserving the socket walls, it is much easier to place a post-extraction implant with immediate loading. The best solution for the patient becomes easier with the magnetic mallet. We are all aware of how many companies are having success with expensive drilling kits for the densification of the bone. In a bit, we will see the differences. The goal of every dentist is to find enough density in order to place the implant, saving on biomaterial or without complicated surgical procedures. With the magnetic mallet used with its osteotomes, we can now condense the bone without generating any heat and consequently without need for irrigation, both in the lower and in the upper jaw. Simple and intuitive. Expanding the bone, once it is reabsorbed, or remodeling it without using biomaterials is always the preferred way. With its pulse, the magnetic mallet shifts and repositions the bone. From the aesthetical point of view, it helps recreating the alveolar structure and enlarging the horizontal dimension, leaving more space to operate. Magnetic mallet. magnetic mallet set a new gold standard in this surgical procedure. We can start with a blade to create the invitation for the other tools to enlarge the palatal and vestibular parts. It is simple, and the doctor can check the protocol, which is available for each of the procedures in a progressive and logical manner, as you can see from the video. As the penetration goes deeper, progressively larger diameters are used, moving the bone 1.1 millimeters at a time. This is the maximum run of the pulse. The blade will easily descend, leveraging on the bone plasticity. The most used technique in the world for the sinus lift procedure is the one from Dr. Summer. But if you ever watched one of these surgeries, you would have noticed that it has many complications for the patient. The magnetic mallet has none of these collateral damages, no hammering, no vertigos, no headaches. The technique is optimal and very common, definitely the most predictable and documented. With cold osteotomes, the magnetic mallet reaches the sinus with a very simple crestal approach. The patients will absolutely appreciate it. one of the most brutal approaches that can happen in a dental office is removing a bridge or a single crown. It is a hammer that bothers and affects all the way to the bottom of the brain. Magnetic mallet has a different handpiece with a reversed pulse and a set of hooks for the crown removing. It is faster and more powerful, avoiding the strikes to break the structures in PFM or zirconia. Simply a magic tool. This is just another way to use it. We understood that the magnetic mallet is very effective and works very well. But why only Meta Ergonomica has developed this concept? Because engineer Mario Merlo is the only one that thought to use a pulse so fast and powerful for oral surgeries. It is so fast that the kinetic energy is not transmitted. The magnetic mallet with its patent makes this pulse unique. The magnetic mallet in the recent years has been extremely successful in the market. It has been presented at several international events, generating great interest in the dental community, as it is considered a real innovation in the industry. It is also appreciated in several universities around the world, such as LSU, NYU, Hamburg University, Gothenburg University, Vienna University, Milan University. The easiest way to use this device is to let the doctor test it in a trial surgery. For this reason, we systematically organize half-day trainings sufficient enough to explain in a simple and understandable way how to use the magnetic mallet. Typically, it is a 4-hour course to explain the way the power wave works, the clinical procedures, and hands-on models. There is not a real competition in the market for the magnetic mallet because it is the only device that can work with this kind of pulse. Nevertheless, there are other types of devices in the market that can be used to perform the same procedures that can be improved and replaced by the use of the magnetic mallet. As of the piezo surgery and its numerous imitations available in the market since the beginning of the 90s made the presence in dental offices of this tool very common. Piezo surgery is extremely different by the magnetic mallet technology as it allows to perform less procedures. It is not infrequent to find a piezo machine dusting on the shelves of a dental office. Consider the differences. The magnetic mallet doesn't need the irrigation water, sensibly increasing the visibility for the doctor. The magnetic mallet doesn't generate any heat, whilst the piezo tends to overheat the bone. If the procedure is not done correctly, there is a risk of overpassing the necrosis point, with obvious consequences in this osseointegration and healing time. The magnetic mallet is much faster. It doesn't take much time for an extraction, an expansion, or the creation of an implant site. In many cases, the execution time is 80% less. The magnetic mallet is used for all the procedures we have earlier mentioned, making of it a device which is used every day in the dental office. It will never sit on the shelves unused. The magnetic mallet is very solid also for what concerns the inserts. The piezo has frequent issues with the duration of its inserts, forcing the doctor to keep buying new ones. You probably noticed that recently in the market, drills for the osteodensification have been successfully launched. It is very intuitive to note why the magnetic mallet presents many advantages compared to these drills to perform the same technique. The magnetic mallet executes the osteodensification through osteotomes, a way that, over the years, has been much more tested and documented. The magnetic mallet, through its single and repeated pulses, compresses the entire surface of the bone. On the contrary, a rotary instrument generates more density towards the apex. Also, the rotation provides to the doctors the control and feeling of how much compression is applied, hence the magnetic mallet is more predictable. The magnetic mallet has many more clinical uses compared to this kit of drills. These drills need to be frequently replaced, whilst the magnetic mallet osteotomes very rarely, since they do not create any friction with the bone. The magnetic mallet provides more opportunities to the doctor to manage the direction of the osteotomy. While the drills are generally self-centering, the magnetic mallet enables the doctor to choose a more palatal direction compared to the socket axis for a better implant placement. There are also manual kits for bone condensing procedures. They usually have the same limitations of the osteodensification drills and works typically on low-density bones. The advantages of the magnetic mallet compared to these kits are: the magnetic mallet can perform the osteodensification also on compressed bone, whilst these kits work only on spongy bone D4, Misch classification. The magnetic mallet compresses all sides and it is easy to use, enabling the doctor to check the undergoing procedures as it is done. These kits have only one application field, the bone densification, whilst the magnetic mallet performs 7 different procedures. Let's consider now the doctors who don't use this type of device and still rely on traditional manual instruments, such as forceps for simple extraction, which is not always so simple to perform. They have to apply more force. There is a high risk of fracture and bone loss. Often the soft tissue is damaged. Swelling and abundant bleeding is caused. Even the use of the drills in implantology in some procedures can be replaced by the use of the magnetic mallet, such as the preparation of the implant site. Wouldn't it be cost-effective for the doctor to shape the existing bone instead of removing it and then replace it with expensive and not always predictable biomaterials? Let's see the main potential damages we can avoid by using the magnetic mallet, facilitating the optimal conversion of the bone and the tissues. Bone loss, damaging of adjacent tissues, damaging of soft tissues, high bone heating with high risk of bone necrosis, affecting the bone regeneration. There are a lot of advantages to catch customers' attention endorsed by clinical and scientific researches. The following are just some of those available in our website to support the message we are conveying. Each procedure has surgical protocols showing step-by-step the way to implement it. Meta Ergonomica has developed several instruments to facilitate the sale of this device, which is changing, actually revolutioning, the way of working of many dentists around the world. The most important question to answer, in order to help a sales rep to sell the magnetic mallet, is how to propose the magnetic mallet to a doctor. We have seen the countless advantages, but it is often difficult to present them all because of the usually limited time available when talking to a doctor. What are the most important keywords to use? What is more likely to be remembered by the doctor when exposed for the first time to the magnetic mallet? Let's see them. Easy. It is an advanced device that performs a very well-known technique easy to teach. A lot of dentists know it. It is easy to use since the first day. Atraumatic. The power wave pulse causes much less trauma than traditional tools, with more comfort for the patient as it is extremely minimally invasive. Cold. The huge difference with all the other devices and tools, drills included, is that the magnetic mallet does not generate any heat, avoiding to reach the necrosis point. Moreover, the visibility is sensibly increased since there is no use of irrigation water. Safe. Literature proves the safety of the device. No broken inserts, no risk of overheating with consequently longer healing times. Multi-purpose. It is used for extraction, bone condensing, bone expansion, implant site preparation, ridge splitting, sinus lift, and crown removal. What to emphasize other than the advantages? Innovation. The device is a revolution in the way the doctor can think and plan. It allows to utilize, again, abandoned and safe techniques. Thanks to a patented unique pulse, it allows the doctor to step into 3.0 dentistry. With a continuous education available and the possibility to become more and more familiar with this fantastic technology. If this would not be enough, what is the other card you can still play to convince the doctor? What can the salesperson do in case the several advantages of the magnetic mallet have not been correctly perceived? The trial surgery. Some reference points are: the trial surgery is okay, but always for a limited number of well-planned cases, 1 or 2 maximum. The trial surgery must be done with a precise plan, such as an extraction or another case well prepared by the doctor. The case must be prepared, making sure the doctor has well understood the protocol and the concept of the magnetic mallet. The trial surgery has to be done on a simple case, as we don't really know what is the level of confidence for the doctor. Overconfidence is rarely helpful. Your presence during the trial surgery is preferred if you are comfortable with that and already had a specific training on how to be in surgeries from a previous job in dental. How to maximize the use of the marketing support of the magnetic mallet. The website has been conceived to guide both the salesperson and the doctor through the understanding of the magnetic mallet. Video, papers, clinical cases, simple and more complex, are available and accessible. A great support is the book of Dr. Resp, edited by Quintessence and available on Amazon. Our records clearly prove that the best way to sell it is clinical presentation with hands-on based on animal tissues, like pig jaws, for example. The conversion rate is very high, over 60% statistically, if the course is well organized. But how to organize the perfect course? The topic of the course will be how to improve the everyday procedures, and the message conveyed must be very pragmatic and practical. There has not been too many attendees in order to guarantee a manageable interaction and allow the necessary time to try the magnetic mallet, understanding its advantages. It is important to prepare the course, informing the doctor on what to expect as new concepts. Make sure he is already aware about the sales proposal. That doctor would expect it anyway. Timing is crucial to score your goal, leveraging on the emotional factor when they are exposed to something they like. The magnetic mallet inevitably will eventually change the way of working of many of your customers, and they will thank you for that. A lot of doctors around the world use it, and with genuine enthusiasm. Promote it. This is just the tip of the iceberg. We can sell magnetic mallet every day to every dentist who accepts the challenge.